up next is our main segment with Dr. Eric Milbrandt. So Dr. Eric is a critical care medicine specialist with over 15 years of experience providing care to the very sickest of hospitalized patients, including those with severe depression. You know, his mission has been to help those who are hurting, especially those with depression, anxiety, PTSD, and even chronic fatigue. So Dr. Eric is a certified trauma professional trained in the most effective trauma therapies. He's got a clinical practice that specializes in ketamine infusion therapies in Ocala, Florida, where in the past 2 years he's been helping patients with mood disorders and addiction and trauma and even spiritual crises. And so I'm really proud to say that Dr. Eric is the newest member of our SoulQuest team, and he joins us as our medical director. And, you know, Dr. Eric, I want to just welcome you to the spotlight and welcome aboard the team here. So glad you're with us.
Excellent. Thanks, Scott. Dr. Scott, that was an awesome introduction. I hope I can live up to that. Give me a moment while I do a quick screen share here so I can get you on a presentation. Okay, there we go.
So I had asked Dr. Eric to present this topic today because I just find it fascinating, and he's got this depth and knowledge and experience here. So I just thought, what a great guy to be able to teach us all about this. So go ahead, Eric.
Cool, thank you. Okay, so again, my name's Eric Milbrandt. Really glad to be here. Super excited to have found SoulQuest and the SoulQuest community. But you might ask yourself, and I certainly ask myself sometimes, who am I and how did I get here? This is a question that I guess it's more existential than anything, but specifically today, I'm a physician, but I really identify with what Jung would have described as the wounded healer archetype. And why do I say that? Well, I've had my own personal struggle with depression, trauma, addiction. Trauma was the seed that underlies both of these difficulties, the depression and the addiction. And I'm just really, really fortunate that I was able to get help. I was able to do the trauma work, work through my other issues, and get to the point where, despite these really difficult things that happened to me, particularly early in life, I was able to turn these difficulties around and realize that they now are the greatest source of my strength. They've given me the gifts of wisdom, understanding, and hope, and really catalyzed in me a passion for helping people with mood disorders and with addiction in particular. That's really what I've been focusing on. About 2 years ago, I got out of the intensive care unit and opened up a ketamine infusion practice in Ocala, Florida. This was something that I hadn't even heard of 3 years ago. I came across an article and thought, I use ketamine all the time in the hospital. Why couldn't I use it to help people who struggle with difficulties with treatment-resistant depression, PTSD, or otherwise? And it just became obvious this was the thing I needed to do to really begin helping others in some ways that were even more meaningful than ICU work. So my passion, my focus is helping others out of the pit of despair. Again, I focus on mood disorders, addiction, trauma, and spiritual crises. The people who come to see me are those that have tried everything. When I say that, I mean everything in traditional medicine. They've tried talk therapy, they've tried all the different Prozacs and Paxils and, you know, you name it, antidepressants that Big Pharma pushes. It turns out that, at least if you just look at depression, 25% of those people that come down with a major depressive episode don't respond to a single traditional thing, not talk therapy, not medicines. And that's a huge chunk of people. And so the beautiful thing, the thing that's made my ketamine practice so much a part of my life and so rewarding is that by doing a series of IV ketamine infusions, I can take that 25%, 3 out of 4 of them will get better, and they get better fast. Life-changing improvements that happen in a matter of days to a couple of weeks, which is super exciting. But if you flip that around, 1 out of 4 don't improve at all. And that is heartbreaking. If you've been in that pit of despair before, you can definitely identify with that sense of hopelessness and helplessness. And so this sent me looking for alternatives. About that time, I picked up Michael Pollan's book, How to Change Your Mind. And I know a lot of you are probably familiar with this. If not, it's a great primer to kind of understand where psychedelics started, where they've been going, and where they're going to. It's really a very well-written book. What I came away from after reading this book, what I came away with was the tremendous potential for psychedelic medicines for both healing and spiritual growth. And I say healing for those who are already suffering from mood disorders, but also spiritual growth for people who aren't suffering from traditional diagnosed mood disorders at all. So I read this book, got super excited. And I realized this could really be some help for that 1 in 4 that I haven't been able to help. And so I dove deep, basically read everything I could on the topic. I signed up for training with the California Institute for Integral Studies, where they train therapists to do this kind of work. And the deeper I got, the more I realized that there's some really strong evidence right now that these medications, this traditional psychedelic medications, can help treatment-resistant mood disorders, addiction, and end-of-life angst. Now, the dilemma, they're still illegal here in the US. If I want to get my clients to get that kind of help, I got to get them in a clinical trial, which there are tremendous waiting lists right now for these, unfortunately. I got to send them to some parts of Europe or maybe Jamaica where these medicines are legal. And that's a real hard thing for a lot of people to do. They think they're going to leave the country and go take mushrooms somewhere. I mean, most people, they just can't get their heads around that. And so I just kept an open mind and kept looking. And then I heard about SoulQuest. And I thought, wow, this is just down the road from where I practice. This is something that maybe I could actually get my clients to. But the more I read about it, I realized, oh, they're doing this in groups. It's not the one-on-one that's being done with actually, if you look at the research studies, it's 2 therapists and 1 person doing a psychedelic therapy session. And I realized, that was impractical. SoulQuest is doing it in groups. Let me come down and check that out. And so I did. That's how I ended up here. Now, before I go more into that, I do want to talk just a couple of slides about ketamine, because most people are really curious about this. There's the molecular structure of it up there on the slide over that kind of colorful brain. It's an anesthetic drug. It's in the same class as PCP, that sort of angel dust you remember hearing about from the 70s. It's still around. Ketamine itself is also known as Special K or cat tranquilizer. Yeah, it's the same medication, but it's also the same medication. It's a great medicine to use in the emergency department and the ICU for painful procedures. It works great in those settings. And about 20 years ago, someone came up with the interesting observation that people who received this for procedures seemed to be happier afterwards, even days to weeks later. And that fortunately got someone scratching their head, and they decided to do the studies they need to do. And they realized that indeed, ketamine is a novel, fast-acting antidepressant. It's given as a series of IV infusions. It works very differently than any other antidepressants. So it doesn't work on serotonin or norepinephrine or dopamine. It binds something called the NMDA receptors, which influence glutamate. And basically, by interacting with these receptors, it causes the release of a brain growth hormone that causes growth of new brain cell connections in the front part of the brain. The front part of your brain is where your logic, your executive function, and the ability to control and modulate your emotions lives. And so by making the front part of your brain better connected, it does a better job of helping you to manage your day-to-day emotions. And what's really cool about ketamine is it very rapidly reverses depression, anxiety, PTSD, and even suicidal ideation. They're using it sometimes now in some emergency departments. When people come in, they're feeling acutely suicidal. It used to be you put them in the hospital for 3 days, which is traumatizing in and of itself. And now you're getting a single injection of ketamine. They observe you for about 4 to 6 hours, get you plugged in with outpatient follow-up, and home you go. So rather than traumatizing people, we actually give them the help they need and get them plugged in with follow-up that'll do the same. So really exciting stuff. As I mentioned, though, it doesn't work for everybody, and it is an IV infusion. Some people are scared to death of needles. It's not a panacea, but it's an important new tool that I really enjoy helping people with. So moving on, what are psychedelics and how do they work? The classic psychedelics, most of them are something called tryptamines, and I'll show you on the next slide what that means. But the medications that fall in this category are things like LSD, psilocybin, and DMT. DMT is one of the components of ayahuasca. We'll talk about that here on a later slide. Now, these tryptamines are structurally very similar to serotonin. Serotonin is one of the major neurotransmitters in your brain. It's the happy drug, if you will. It's the thing that a lot of the antidepressants work on. They are selective serotonin reuptake inhibitors. So serotonin is very important for mood as well as a lot of other things. And the chemical name for serotonin is 5-hydroxytryptophan, or 5-HTP. You may have seen 5-HTP as a supplement in the health food stores. That's what you're taking. It's serotonin, basically. One that can cross the blood-brain barrier and influence mood. So serotonin, again, it influences mood. It also influences vision and auditory perception, which becomes relevant when you start talking about tweaking it with psychedelics. The classic psychedelics, they bind specific serotonin receptors in the brain, and there's a whole host of different receptors. The particular one that they interact with, which is the mechanism of action, is something called the 5-HT2A receptor. It's a bit of a mouthful, but 5-HT2A receptor. Binding that receptor leads to profound changes in perception and consciousness, and basically gives you the trip, if you will. And I'll go a little bit more into how that happens, but remember, the 5-HT2A receptors, those are the important ones. And so what happens when psychedelics bind to these receptors? Well, essentially, it takes something in the brain called the default mode network, which is a network of different structures in the brain responsible for your sense of self, which I'll show you what that network looks like in the next slide. But it takes the default mode network offline, and that's a really, really important point. So before we get to the default mode network itself, I do want to just show you briefly chemical structure. I mentioned serotonin, which is up here, 5-HT serotonin. You can see what that molecule looks like. DMT to the right of it looks almost exactly alike. Ergotamine, which is another psychedelic, LSD, has that same chemical backbone in there, which is so similar to the neurotransmitter serotonin. That's why these molecules work with binding that 5-HT2A receptor, because they're like lock and key. The key is very, very similar. And these little side pieces are just the difference that make them behave differently as opposed to serotonin itself. So default mode network. This is several areas in the brain that are interconnected. And I've got a couple slides here to show you that. The one on the top, you can see these hot areas in the brain on the top part of the skull here, top part of the picture, which is the front part of your brain, right between your eyes. In the back here, which is here, to the right and to the left. If you look at it from the side, you get a little bit of perspective too. Again, the front part, back part of the brain. If you're looking at it in a more stylized fashion, this is the front part of the brain here and to the right of the slide, and then various other interconnected areas. These areas form a network, and what this network is there are these connected parts of the brain that are most active when you're doing nothing, when you're just sitting there, not focused on a task, just being yourself. They are very active when your mind is wandering, when you're daydreaming, when you're ruminating about something that's difficult or bothersome, when you're reflecting about the past or thinking about the future, or maybe worrying about those. The default mode network acts as a filter or a reducing valve. And the best analogy for this is, think about a pair of glasses, right? You put these on, you hope the prescription's right, and it's going to help you see the world in a certain way. Well, imagine if these glasses are tinted. Let's say maybe they're tinted blue. So I put my blue glasses on, and suddenly the whole world looks blue. All of my experiences up to this point in my life have influenced the default mode network to make me see the world in a certain way. The trouble is, because of that blue tint, I also can't see really important parts of the world around me. So there may be something right in front of my face, literally or figuratively, but because of this filtering and reducing valve action, the default mode network, I can't see it. I got these blue glasses on, I got to take them off. I got to get that filter away from my eyes so I can actually see more of what's around me. The default mode network gives you this sense of self, your ego, if you will. It's responsible for this feeling of separateness from others and from nature. Interestingly, kids don't have an active default mode network. It starts to come online maybe around 6 or 7, but it still isn't functional really until about the age of 10. And so if you think about kids, what do? They see and experience this world as this great big thing, and everything is new. They ask curious questions. They aren't limited by the idea of what's possible and what's impossible. They don't have these damn blue glasses on that are fogging their vision. So kids' brains actually can get really, really creative. And you see that acting out in play or other things. It's just really interesting to know that, we think we're more mature and more specialized as adults. We are in many ways, but we also are more limited in other ways too. So default mode network and psychedelics, what happens here? Well, thinking about the default mode network, if it's overactive and dysfunctional, it leads to narrow and rigid thinking. Like you've got really dark blue glasses on, you can't see a darn thing except the little bit of light that gets through those. That narrow, rigid thinking leads to repetitive, destructive loops of rumination, constantly worrying about the problems that you have, not being able to see the solution around you, being closed off from others in the world. We get caught on our problems, essentially, and we can't see those potential solutions. How does that manifest? Addictions, depression, anxiety, PTSD, obsessive compulsive disorder, eating disorders, you name it. These illnesses, these mood disorders, are characteristically classified as having narrow, rigid thinking where you just can't see the way out. If we temporarily take the default mode network offline with psychedelics, we do some really cool things. First, it gets the ego out of the way. This is that ego dissolution, which everybody talks about with psychedelic therapy, where suddenly you are no longer separate from others, separate from the world, separate from nature. You become one. So taking the default mode network offline gets the ego out of the way. It takes off the glasses. It gives you new ways of seeing your world, your problems, what might be holding you back, and some of the solutions that might present themselves that were there all along, but you couldn't see them. It essentially performs a physiologic reset of the default mode network, making it work like it's supposed to. And a better functioning default mode network means relief of mood disorders and addictions. So that's basically what's going on there, and why psychedelics seem to be so beneficial when other medications like your Prozac or Paxil that don't work this way only seem to just blunt and block symptoms rather than actually making you better. So get the default mode network offline. There's another interesting thing that happens is all these other different networks in the brain suddenly just take off and bloom. And so you get a massive increase in crosstalk between these different networks. And then in this image here, you've got on the right-hand side, which is a little more clear to see, this is just brain and people giving placebo. These are electrical connections, talking back and forth. It's done using a special kind of imaging. Each color is a different network, and you can see at rest without the influence of any kind of a psychedelic. There's mostly the networks talk to themselves, but then they occasionally talk to each other. Give a patient psilocybin, put them in the scanning machine, scan their networks, and you realize suddenly communications bloom. Not only is there more talk within each network, but a huge increase in crosstalk across networks. Basically, the filter has come off. The blue dark colored glasses have come off. And again, you're able to see a lot more that you couldn't see before. This is also the reason why you have hallucinations and visions, because you've got parts of your brain communicating that normally don't talk to each other. So think about tapping into the visual and the auditory parts of your brain. Now suddenly they're giving a lot more input in places they don't normally, and so you can see and hear things. There's this phenomenon called synesthesia, where you can taste colors, or the sounds have flavors. Different numbers actually are represented in different figures. Mathematics suddenly becomes a language that you can speak. So it ends up mixing up different senses so that your vision and your hearing and your touch and all that are just cross-talking. This allows you to see and feel and hear things you can't normally. That the visuals are great. Everyone loves visuals, but what really at the root of helping people recover or spiritually grow is helping them make connections that they couldn't make before, helping them to solve their problems, helping them to open their mind and realize that, okay, it isn't all about me. I'm not really separate. I am one with the universe. And if I just get that ego out of the way a little more often, maybe I'm going to be a whole lot healthier. So, Yeah, I kind of covered this already, and basically you get this big increase in creativity, empathy, well-being. Now, so you might think, man, how could I take my default mode network offline more often? That sounds great. Remember, kids' brains, this is their default. But interestingly, not only do psychedelics make this change, but other things that are available without having to take a medicine, such as breath work, meditation, fasting, prayer, near-death experiences, sensory deprivation like float tanks, extreme sports, instances of overwhelming awe. All of these things also do this very same thing. They take the default mode network offline. They let the rest of your brain start talking to itself in ways that it can't normally do. And so you think about, well, why does meditation help? I'm a big breathwork practitioner. I love it. It has helped me tremendously with my own personal health, my mental health, my spiritual well-being. I had no idea this is what I was doing, but now I understand why it works, and it really does work. So cool stuff. Not everyone can take psychedelics. They're not safe for everybody, but almost anyone can meditate. All right, research and legal issues. I'm not going to get down to all the individual studies, but suffice to say that a growing number of studies are showing not just short-term, but long-term benefits for psychedelics when used in a structured setting, in a therapeutic environment. They're showing improvement with treatment-resistant mood disorders, addiction, end-of-life anxiety, an increased sense of well-being and spiritual growth. Some really cool stuff going on. These studies actually started back in the 50s and 60s and early 70s. They took a temporary hiatus during, with the difficulties, thanks to Nixon, really, but I won't get into that. And then thankfully now we're experiencing a significant resurgence, especially with compounds like MDMA and psilocybin. We've got legitimate groups that are doing research, which I'll talk about, I believe, on another slide, but won't get into the specifics. Just know that this is actually legitimate researchers doing legitimate studies using real people and real measures are showing that these things really do work. Now, legal issues, bear in mind, all psychedelics currently are categorized by the DEA as being Schedule 1, which means they have no currently accepted medical use. Marijuana also fits in that category too. And so we can see the paradox with a Schedule 1 classification that medicines that actually do seem to be helpful are still stuck in that category, but we've got some important changes I think that'll be coming. So groups like MAPS, which is the Multidisciplinary Association for Psychedelic Studies, it's based in the Northeast, and COMPASS, which I can't remember what COMPASS stands for, but they're actually conducting phase 2 and phase 3 clinical pharmacologic studies to prove the efficacy for drugs like medicines like MDMA and psilocybin for the conditions I mentioned before. They're working very closely with the DEA and the FDA to do this the right way, to actually get approval for medical use. Doing this how it should have been done back in the 60s and 70s before basically everything got outlawed. Interestingly, a number of states are beginning to loosen their regulations too, in the same way that medical cannabis has undergone a transformation. Colorado already has either legalized or decriminalized psilocybin. LA County has done the same. Oregon has a ballot measure that's coming up just this week to basically make all controlled substances will no longer be criminal. So they're going to decriminalize controlled substances and put the money, instead of prosecuting and imprisoning people, put the money to treatment and helping people, which I mean just makes so much sense. There are certain religious use exemptions if you use the medicines for ritual use for sacrament-based religious ceremonies. Ayahuasca is one of those, and Soul Quest kind of falls into that category. Peyote is another example. Native American churches are allowed to use that in ceremonies here in the US. So there already are some exemptions, but what we really need is more either decriminalization or frank legalization so that these medications can be used safely and effectively. Let's see, where are we at? Oh yeah, so before I move on, I do want to just highlight the fact that studies really are showing these medicines to be effective, but what it isn't is basically giving someone a bag of mushrooms and sending them out into the woods and telling them to go meditate and have a good time. The studies that are being done actually are done in a setting where you've got structure, you've got a therapist helping you out. And I'll talk a little bit more about what that looks like here a few slides later, but I just want to really underscore that, you know, what happened in the late 60s and early 70s is these things got widespread use without proper guidance. And some people were hurt because the medicines weren't used the right way. I'm not all for locking things down so that it has to be done in a hospital or something like that, but there clearly are ways to use these medicines that can maximize safety and maximize gains. So I do want to talk about DMT, the specific molecule that is the active ingredient in ayahuasca. Again, it is a tryptamine-based psychedelic medicine, so it operates at that 5-HT2A receptor. Interestingly, DMT is a naturally occurring substance that occurs throughout nature. It's everywhere. It's in plants, it's in animals, it's in us. It's just all over the place. And it is a signaling molecule, both within organisms and probably between organisms as well, which really, we could go down a rabbit hole with that one. If it's injected into the body, it immediately produces an intense spiritual out-of-body experience. Because it was so intensely spiritual that it ended up, someone coined the phrase, calling this the spirit molecule. The DMT in our own bodies occurs in a variety of tissues and organs, including the pineal gland. The pineal gland is a small light-sensing gland that's in the center of the brain. Here in the middle of this brain, you can see where the arrow points to it, really close to the brainstem and to the ventricles. It is responsible for circadian rhythm and melatonin production. It's the reason why you maybe felt a little sleep hungover today because of the time change. Your body thinks it's an hour different. You will reset, thankfully. It is considered by many to be the seat of the soul, or the third eye, or a gateway to other worlds because of this unique position that it presents. It is thought that during life-threatening situations, the pineal gland releases massive amounts of DMT, and this may be responsible for the characteristic of these mystical near-death experiences that people have, although that hasn't been proven definitively yet. So what is ayahuasca? Ayahuasca is a mixture of two plants from the Amazon. I'm going to do my best to pronounce this. I'm not even good. B. capi, how about that? That's the ayahuasca vine. It is the source of something called HARMA alkaloids. They are monoamine oxidase inhibitors, and I'll explain what that means here in a bit. The other one is Psychotropha viridis, the chacruna plant. It is the source of DMT. Now, there are over 80,000 plant species in the Amazon. Finding the right combination, mixing these two together, cooking it the right way, in a way that it is a therapeutic, helpful medicine, how would that ever possibly happen? I mean, you know, just put me in the kitchen and try and come up with a good dish by mixing spices together randomly. It doesn't usually turn out real well. And so I have to believe this is a gift from our maker, a gift from the source. I think that the people of the Amazon basin were led to bring these two components together in the right way as a gift to humankind to bring about healing and change. Ayahuasca in the gut. So ayahuasca is taken by mouth. And normally, if you just take a dose of DMT by mouth, it is instantly broken down by enzymes in the gut and the liver. These enzymes are called monoamine oxidases, and they just break it down instantly. So you don't absorb any of it. None of it is biologically active. However, if you take an inhibitor of these monoamine oxidases, so the MAOIs, which you've heard of, it prevents the DMT from being broken down so it can be absorbed. That's where the HARMA alkaloids that are present in the ayahuasca vine become very, very important. Otherwise, the chacruna by itself with its DMT wouldn't do a darn thing. These two things have to be together. That way the DMT can be rapidly absorbed. It's transported to the brain where it binds the 5-HT2A receptors, and you get the onset of a psychedelic experience in about 20 to 60 minutes, roughly. Now, if you've ever experienced ayahuasca, you know that vomiting or purging is common. It's actually thought to be kind of an important part of the ceremony. It has important symbolic representation in terms of purging some of the difficult things that perhaps you've been holding on to. Biochemically, what happens, that same DMT, which gives you the psychedelic experience by binding the 5-HT2A receptors, it also binds another type of receptor, another serotonin receptor. This is the 5-HT3. Those receptors are in a part of your brain called the area postrema That's the part of your brain that controls the urge to vomit. Really could do without those 5-HT3 receptors, but they're there, you got to deal with them. The gut also has some of these same receptors, and it's thought that may also contribute to some of the nausea, the vomiting, and diarrhea that sometimes happens. Sometimes it comes out both ends. Woohoo! You had a lot you were holding on to, and it had to go. So that's why that phenomena happens, because it's, most compounds that bind brain receptors, they can be fairly specific, but there's crosstalk to different receptors, and it's that 5-HT3 receptor that's the problem. Or maybe not the problem. I mean, again, the purge is not seen as a bad thing when it comes to ayahuasca ceremony. So ayahuasca safety issues. It's been used safely by indigenous people of the Amazon for centuries. No one knows exactly when it first came to being, but bottom line is they know how to use it and they know how to use it safely. Now, how can we do the same? Now, because of the monoamine oxidase inhibitors, the harmine alkaloids, and because it tweaks serotonin in your brain, you must avoid certain medicines and foods prior to ceremony. These include a lot of different types of antidepressants. Some antidepressants are MAOIs as well. You would naturally want to avoid those. Anything that messes with serotonin, so your SSRIs, your SNRIs, you just need to have out of your body. Otherwise, you take a real chance of jacking your serotonin levels up way too high, or getting your other neurotransmitters levels up way too high. Other things to avoid, certain types of appetite suppressants, certain types of cold medicines, any illicit drugs. And interestingly, there's dietary restrictions as well. Basically, anything that's smoked, aged, or fermented, you want to stay the heck away from. The reason is that it often contains certain kinds of molecules that will also interact with the monoamines, tyramines and tryptamines. Basically, what happens is either your serotonin gets too high, your norepinephrine, or your dopamine get too high. These all can either cause a dangerously high rise in blood pressure or something called serotonin syndrome, which I won't get into, except that it's very dangerous and can be lethal. So when you prepare for your ceremony at SoulQuest, they talk about what to avoid, and you hear the phrase, you lie, you die, and it's the truth. Now, does that happen? Not likely, but it could. And God forbid you come down to try and really help yourself heal, and you do something silly and not tell people about what the kind of medicines you've been on, and end up getting really hurt or harmed. So take these restrictions seriously. You really just, I can't stress this enough. It's super important. So are psychedelics safe? Well, we talked about things to avoid with ayahuasca. In general, just looking at all psychedelics, they are clearly powerful and safe medicines with tremendous healing potential, but they need to be used responsibly. A structured, preferably medically supervised setting with adequate screening, preparation, and integration afterwards. So again, we have these powerful experiences. We need to do something with them afterwards, whether it's the online integration sessions that SoulQuest offers, working with a therapist, journaling and meditating on your own. You will get the most out of your sessions if you take what you get from the sessions and work with it. It isn't just a pill you pop and suddenly you're fixed. You've got to do the work afterwards in order to really heal and grow. It's very important to pay attention to set and setting. Set is your mindset going into it. What have you been thinking about? What have you been involved with? What are you worried about? You must prepare for and preferably set an intention, although ayahuasca doesn't always respect your intention. It will give you what you need, not necessarily what you want. Setting is also very important, and setting is just the setting in which you do it. A warm, healing environment, surrounded by people who care, people who can watch out for your safety, nice music, maybe even a darkened room. Some people wear eye shades, listen to soundtracks, but you can imagine something as powerful as this, and maybe we drop you instead in the middle of a horror movie. Not a good setting to be in while you're doing psychedelics for a therapeutic purpose. So you want to be surrounded by love and people who can take care of you and help you, especially if things get challenging. And I think I mentioned earlier, it doesn't make sense to just give someone a bag of shrooms and send them out in the woods to meditate. Could they benefit from it? Possibly, not nearly as much as they do this the right way, the way it's supposed to be done. And certainly they could be harmed by that kind of approach. So what about bad trips? Everyone talks about bad trips. Content and intensity of psychedelic experiences may sometimes feel overwhelming. Very true. If you've prepared beforehand and know what to expect and are working with people, either experienced healers or facilitators that can help you during these challenging times, bad trips are actually not bad at all. In fact, when properly navigated, these difficult experiences can be a tremendous source of material for healing and personal growth. That's where during and afterwards, you've got to use what comes up and work on it. Work on it with a therapist, work on it with a shaman, work on it through your journaling, your meditation. The bad stuff can actually be the best stuff. It's usually the things that you really need to work on and heal from. But again, if you're in a place where someone can help you through it, even when it's intense during, you're going to be just fine. You just have to trust the process and make sure that what you come away with is what you work on later. So this is my last slide. And I've been asked, what are my plans as medical director here? Well, first and foremost, when I came down to SoulQuest to check it out to see if it was going to be okay for my clients to send them down, because I wanted to make sure it was going to be safe. I was trying to imagine what psychedelics in a group setting would look like and how that would be safely done, and to be sure that integration was done afterwards, as well as the preparatory work. And what I found indeed is that SoulQuest already is doing that like really, really well. It's a professional, caring, and safe program. I feel very comfortable sending my clients down there to get the kind of help that they need, and I'm not going to worry about them. Now, where could we do better? One of the things I want to do is work with the SoulQuest medical team to ensure not only continued responsible, but safe use of these healing medicines, including developing protocols for rescue therapies in cases of extreme psychological agitation. Now, one of the things I'm really excited about, there are anywhere between 80 and 100 retreat participants each weekend at SoulQuest. And it's an incredible amount of real world experience with psychedelics. Taking these experiences, looking at outcomes, and informing the practice of psychedelic medicine, psychedelic therapy, with this information that's been gathered outside the confines of a tightly controlled clinical trial. And the way the clinical trials are done, I mentioned, you've got 2 therapists, 1 participant. It's really intense, basically 2-on-1 kind of stuff. And that's just not practical for the real world. There aren't enough therapists to go around for all the people that need these kind of healing medicines. And so SoulQuest is already doing it great in a group setting. I know they're already collecting data. I want to take this data, analyze it, study it the best we can, figure out what best practices are, and get that information out to the world so that other people can see how this can be safely done in a way that helps the most number of people possible. I'm also really excited about all the Zoom conferencing technology that SoulQuest is using, already using it in a large scale to facilitate post-retreat integration, because once people leave their retreat weekend, they often go back home to different parts of the country or different parts of the world. It's important that they be able to connect with people that can help them with this integration. And there's already a ton of that going on at SoulQuest. I'd like to look at that in detail, figure out, what are the parameters for doing it and doing it right? How can we share that with the rest of the world so that others can benefit from the knowledge that we're gaining here? Basically, I want to help grow the program to reach as many in need as possible. I want to be an advocate for these healing plant medicines to the medical profession, many of which are very close-minded to this whole idea, and to society as a whole. So I'm super excited about this. I really, to meet another group where our passions and our vision line up so perfectly. There's obvious synchronicity here, and just so much going on. I'm just excited to be a part of it.
Thank you, Dr. Eric. That's absolutely everything I've ever wanted to know about this topic. I mean, we are so lucky to have you. And, I'm sitting here and I'm so proud of you, and I'm proud of the way that you present yourself and the depth of knowledge and understanding that you have. We do everything that we can here at SoulQuest to make sure that we have the safest setting and that our standards are the gold standard. And, I'm sure that the folks that are watching here today are just also feel the same way. Like, I'm so glad that you're with us. and
You.
because you're a treasure, and a lot of great stuff. A lot of great stuff. You know, there were a couple of folks in the chat that were asking about the possibility of getting your slides. Is that something that we might be able to do?
Absolutely. You know, that would be no problem at all. What I can do, I don't have a link.
We can put them. We can put them on the Facebook page, and
Okay,
make that possible afterwards, and
perfect.
or put them in a link in your in this particular episode on the Sunday service links. We can put that there as well.
Okay.
So, but you know, I've been fascinated about this default mode network and the way you explain that. You know, the work with Stan Groff, you know, and the holotropic breath work, you know, was all about that, because after Timothy Leary, you know, put a kibosh on the psychedelic research, we went right into the breath work as a way of continuing with that default mode network. And so I know you're a holotropic breathwork trainer, you're training as well, and fascinating stuff. But it really was helpful for me. I want to open up the call to folks. I see Brian has his hand up, brother, because I know folks have questions for you, but fascinating presentation. And I just love what you're doing. Go ahead, Brian.
Yeah, thank you so much, man. That was so profound. And I'm a geek, so I love neuroscience and medicines and how the interactions work. And I just want to say thank you, because I felt like I was an extreme sport athlete. So I did MMA and wrestling, and you know, anything I could hurt my body or hurt somebody else, I did. And I can see that you referenced kind of first of all, the lungs with DMT, the meditative state, and then in these extreme situations, you kind of turn the default mode network off. And for me, I never understood that I always felt alive when my default mode was off, when I wasn't me wrestling, but it felt like I was being wrestled through God or something like that. And so a connection was just made for me why I slipped into deep depression when I gave up sports and just started drinking alcohol to try to compensate for this spiritual place I probably was routinely experiencing every single day. And so that just reaffirms a lot for me. And so my question for you is, you know, now that I know that that's great, so we talked about the disillusion of the default mode network and the experience of that kind of ego death that you feel when the medicine is coming online, your default mode is going offline, and that's pretty scary. Now, what about the come down from the medicine where the default mode network is turning back online? What is different, maybe chemically or neurologically, that's happening when the default mode network is coming back online now after coming from that spiritual experience, and how to maybe better integrate that come down phase back into not as low as you used to be, but at the higher, more sustained spiritual level?
That's a great question. And I can definitely relate to what you're saying about sports. I used to be a triathlete. I mean, I was all about going faster. And I love the intensity. You know, I love to exercise to the point where I almost puke, right? And I had no idea that was what was going on either. But, and when I stopped doing that for a period, my depression got much worse. And so I think you're definitely onto something there. Like anything though, like any solution, it can be taken to extremes, and we can just destroy ourselves physically with extreme sports, or punish ourselves too. And there's an aspect of that with regards to people suffering from trauma. Now, in managing, you know, so the default mode network comes back online, because you can't spend your whole life with it offline, because then you'd be wandering around like a 5-year-old just staring at every little thing, a squirrel that runs by. I mean, you actually do need some of these other networks. They're important to be able to focus and to achieve. So what seems to happen in the short term as well as the longer term is that the changes that happen acutely during your experience, they change the way the default mode network works subsequently. And so it's not a complete rewire, but you've got some parts of the default mode that become more active, some parts that become less active, and it seemed to bring it in better balance, so that rather than being so extreme and so negative and so hyper-focused, it brings it back down to the point where it just functions a little bit more like a well-oiled machine, something that You can focus when you need to, but you're not obsessed about everything negative that's going on in your life, which is the epitome of depression. I mean, when you're really down on that pit of despair, everything looks terrible. You can't see, if there was $1 million sitting on your desk, it'd be like, but the money's dirty. You know, I mean, it's hard to see positive when you're down there. And so what seems to happen, if you look at the imaging studies, before, during, and after psilocybin sessions, and when I say after, I mean like, days to weeks afterwards, is you've got changing activity. Some areas a little bit more active, some areas a little less active, but overall, it seems to balance out the default mode network, so it isn't so hyper acute.
Excellent.
Thank you.
Yeah, thank you. Dr. Eric, is there a relationship between the default mode network and the reticular activating system, the RAS? They both are filtering. Are they totally different? Is one more the reptilian part of our brain versus the ego, how do they differ?
So that's a really good question. And if I had that other slide up, I might be able to see if that's a piece of it. So the reticular activating network is mostly responsible for day-to-day arousal. When it's offline, you're out asleep, and it's responsible for you being awake, alert, and able to pay attention. And there must be some crosstalk between those two. It wouldn't surprise me if the reticular activating network is a piece of the default mode network as well. But I haven't seen anyone specifically address that. That's a really good question, Dr. Scott.
I think that Ron has a question for you.
Yeah, just a quick question, because I understand that the monoamine oxidase inhibitor effect also prevents you from metabolizing serotonin as quickly. And I think that might be unique to ayahuasca. And I was wondering if you could comment on the effects of having added serotonin in combination with the dimethyltryptamine.
Yes, so very much so. Certain monoamine oxidase inhibitors are actually used as antidepressants for that very reason, and your monoamines are serotonin, norepinephrine, and dopamine. Dopamine, it's another amine. And so the monoamines break down all those different neurotransmitters. And so if you inhibit their breakdown, you're going to have higher levels. So I would imagine acutely that also contributes to some of the good feelings that people experience while they're undergoing ayahuasca. I'm not sure pharmacologically how long the ayahuasca vine, the harmine alkaloids, how long they last. My guess is probably 6 to 12 hours or something. Whether they have a persistent effect in the body or not, I'm not sure. But undoubtedly that contributes to it to some degree. It probably flavors the experience versus, say, an LSD experience, there is no monoamine oxidase inhibitor in LSD. It's just straight tryptamine. But good question. I'm not sure how. I think it flavors the experience. That may be why the two drugs are not quite the same. Granted, they look different molecularly. That lock and key, they've got different side chains, and so that's probably part of the reason they're different too. But if you talk with people, some people really prefer ayahuasca and the experience there, and others much prefer LSD, and others prefer, Bufo alvarius, the toad, the 5-MeO-DMT. They all have different flavors, different subtleties, and those different side chains, as well as the presence or absence of an MAOI, undoubtedly flavor the experience.
Okay, so Ramon, you have a question for Dr. Eric?
Oh, hi, Dr. Scott. How are you?
Hi, Ramon. Good to see you. Hey, Ramon, thank you for that book, by the way.
Oh, absolutely. Thank you so much. I'm actually right now traveling some overseas. The internet is pretty spotty, so I'll keep the video off if you don't mind. Well, thank you. I mean, listen, it's just amazing where Soul Quest is and how it's progressing. I mean, I remember the old days. It's just going the right direction. Honestly, I'm so happy and glad to be part of this family. And now we have professionals who are joining in. And, I had a couple of questions for Dr. Eric. So it seems, maybe this is a question for you, Dr. Scott, too. It seems that SoulQuest is going into possibly the research field. Is that something you're thinking of? Because, I read research papers, but they're mostly done in Europe. But it's quite interesting to see how SoulQuest could leverage on the high number of members who come in the thousands. And maybe, who knows, maybe one day you'll have participants who would wear an EEG device where we could really figure out what's happening in the brain.
And who knows, we could get an MRI in the other room and a CAT scan going. Yeah, but Ramon, that's always been our intention. You know, Verena is a statistician, and, you know, she's finishing up her PhD, but she does the clinical studies, and she's always been involved in this whole concept of doing the research component to this. And so we paused the surveys that have been going on for 3 years now, and because of the pandemic, because it skews the way the study design. But, you know, her intention has been to publish this information, and of course, you know, with Dr. Eric involved, you know, that's what we want to do. We want to do this well and represent the you know, the community with the, you know, highest integrity. But Eric, do you want to talk about that?
I'm sorry, my mind was wandering. I was looking at the chat, the questions.
Yeah, we were. It was about about doing clinical research, and about, you know, how that's a part of the path in the future. What we're looking to do with the numbers that we have. I mean, we have quite a large number of people. You know, we've got, you know, 180 to 100 every weekend. Now, not all of them respond to the surveys that are out there, but, you know, many of them do, and many of them probably will when we really try to emphasize this. But once the pandemic is clear, then we'll be able to get a normal, you know, a comparative data set. But go ahead.
So yeah, I would definitely
very quickly.
Okay.
Just, this is the second question that you might want to answer to. I mean, I don't know if you have a comment. So there is this interesting research paper that came out of Brazil. Basically, they analyzed, there's a famous church there, I think it's not UDV, but the Santo Damian yes, church. And so they analyzed what would the long-term implications be for participants who take ayahuasca on a regular basis. I mean, they've analyzed people who take ayahuasca twice a month for a year or two, and it seems that their results are, you know, positive. I mean, it seems that there are positive implications, meaning good memories, and they had a number of good things that were coming out of that paper. So, but it seems for ketamine, it's a bit different. I'm not sure. I mean, I've came, you know, 2 different papers that had 2 different conflicting answers, but I'm not a medical doctor, so I couldn't really dissect the papers properly. So if you have a question about, you know, ayahuasca versus ketamine in terms of these long-term outcomes, thank you.
So good question. Very different mechanisms of action. The ketamine does not influence the default mode network. It works more through the NMDA receptor and regrowing connections specifically in the front part of the brain. I don't think anyone's looked at ketamine specifically for the default mode network, but just knowing that it's interacting with a totally different receptor, I can't imagine it has a similar influence. If you do respond to ketamine therapy, you do have to kind of maintain with ketamine therapy as well. It requires a monthly infusion, which is one of its drawbacks because of the time and expense of that. Just looking at the long-term improvements with any medicine, whether it's ayahuasca, other psychedelics, ketamine, or even Prozac, these medicines help, but it's so important that you do the work afterwards. I see the biggest role for any of these medicines. If you're in the pit of despair, you can barely get out of bed, let alone do the intense psychological work that you need to do in order to heal and to grow spiritually. And so what these medicines do is they elevate and lift the mood enough that they're actually able to do the work. They're totally different mechanisms of action. I do think that they're, you know, the ayahuasca and other psychedelics on their own, they do have some lasting effects beyond anything that ketamine can do. But I tell all of my clients and anyone I interact with, that no matter what medicine you're using to help facilitate your journey, work with someone to help you heal. Most of us carry around trauma of one way, shape, or form. Some of us have never even delved into it. Most of us don't want to, but I found that even once I recovered from addiction and I got on medicine to help me with depression, I still was miserable 2 years later. And it wasn't until I started doing the trauma work and actually dealing with the stuff that happened to me as a kid, dealing with the things that happened as an adult. Once I started working through and dealing with those and getting comfortable in my own body and reconnected with others, that's when I became whole again. So, what the right frequency is, whether it's twice a week, twice a year, or once in a lifetime, I don't really know the answers to those, but I do know that all of these medicines, all of these treatments, these therapies, they've got to be coupled with doing the work. They just have to be. It's the only way you're going to really take something away from an experience like ayahuasca or anything else.
All right, thank you. So Susan has a question for you. Hi, Susan. Great to see you. You want to unmute yourself? Yeah. There you are.
There I am. Thank you. I have a question for Dr. Eric. I'm wondering if you've done any work with brain injuries, like concussions, traumatic brain injuries, with the ketamine.
Not in the acute setting, but after someone has kind of recovered and reintegrated into society, only a little bit. One particular client that I've taken care of that is about 18 or 19 years old and had an ATV accident, big time brain injury, recovered thankfully, has trouble with intermittent explosive outbursts now because of that, and trouble with depression as well, and probably some trauma, though he hasn't yet owned up to that, but I know it's there. I mean, anyone who goes through a life-threatening experience like that often will have residual. Ketamine has been a huge help for him. Now that's an N of 1, so I mean, it doesn't really give you an informed opinion there. Any kind of a situation where you've got trouble with your prefrontal cortex, that front part of your brain, the executive function and emotion modulating part of your brain, ketamine has the potential to help with that. So, if you've got perhaps, brain injury in other parts of the brain, I think it's going to be a bit more of a stretch, but it's going to really kind of depend. Everyone is different. And so I can't really answer your question completely, I'm afraid.
Can I expand on the question?
Yes, please.
11 years ago in 2011, on Route 95, I rolled my car with loss of consciousness, broke all the glass. The car ended up upright. I ended up changed from that day with fatigue, brain fog, anhedonia, and memory problems. And I haven't been able to find anybody who has any idea how to treat that. I've been offered antidepressants. I'm not depressed. I am not depressed, but I can tell you the day before the accident and the day after the accident, I was changed in my function and approach to the world. And I've done 3 weekends at Soul Quest. What a wonderful place. Dr. Scott has just helped me so much spiritually, but not with this. Not with the organic interface that I'm having trouble with. And I'm still looking. So here I am asking you.
So tell me, without getting too deep into this, because I know others have questions, but tell me, did you have head trauma to the head itself?
Yeah. When I woke up, I had road rash on my temple. I was driving the car, so the car went over this way, and when I woke up, I had gravel and stuff embedded in my temple, superficially. I don't really know what happened during the rollover because I wasn't conscious. I did wake up in the middle and find myself upside down, but I went out again immediately. But
Okay.
the change, the anhedonia. I mean, I had spent all of my adult life as a nurse. I was a flight attendant for 15 years. I mean, I was a going, happening, fun person. And after the accident, I'm still a fun person, but all that changed.
So I can't
I
tell.
miss that person. I miss that person.
Absolutely. I'm sorry that you went through what you did, and that my gut feeling is that it was the trauma itself that changed you. And I don't mean the physical trauma. I mean the emotional, experiential trauma. And, that's hard for a lot of people to get their heads around, because they think, well, I've kind of dealt with it. I've talked about it, whatever. Having a traumatic experience, a near-death experience, any of those sorts of things, and changes your brain. It changes your brain. It changes your ability to focus, your impression of the world, your ability to deal with just regular life. There are a bunch of really good books about that. One you might consider looking at is called The Body Keeps Score. There we go, by Vanderkolk. And this is probably one of the best ones that I've read. I've read quite a few, but it really explains, and it deals with a lot of different types of trauma. Motor vehicle accidents, one of them, but other things like child abuse, sexual molestation, abandonment. I mean, the list is long, but the effects are the same, and it does change our brains, and the body does remember. The body keeps score. The important thing is that by doing the trauma work, you actually can work through a lot of that and reclaim your normal brain, your normal body, your sense of enjoyment in life. This is what I had to do, is do this kind of work. And it really has helped me tremendously to move past the things that had happened to me. Mine wasn't a motor vehicle accident, it was very different, but in the end, it was the same. So that might be something worth looking at. Just regarding brain injury in general, I mean, there are things you can do in terms of hyperbaric oxygen, stuff like that. It's not clear that you had I'm sure you had a concussion. I'm not sure whether you would benefit from hyperbarics or not, but I do think you would benefit from some additional trauma work stuff. It sounds like you've kind of already started at SoulQuest. We're working with Dr. Scott and others.
Mm-hmm. Well, how do you do trauma work if you seriously can't remember the trauma? I've been hypnotized in past life regression therapy and asked the question, why can't I remember? And the answer came back, it's a kindness.
So memory loss of the event itself is really common in trauma, and there are different ways to work through that as the material begins to emerge. A gift, someone who's trained in trauma therapy, a trauma therapist, is someone who can help you work through that. I know there are people at SoulQuest that fit that category, and then lots of other people as well. But it's really important that whoever you work with, you make sure that they actually do have a trauma background, because it is different. It's not through the traditional Freudian psychoanalysis. That kind of stuff doesn't really help in this situation.
Right. Thank you. I appreciate it. I'll follow up with Dr. Scott.
You're welcome.
But thank you. I appreciate it.
Yeah. Thanks, Susan. Okay. So who else has a question for Dr. Eric? We are just about at the hour mark, the hour and a half mark. So we've got a time for one or two more questions. One more. Go ahead and unmute yourself. So Dr. Eric, if somebody wanted to do any kind of work with you, what would be a way for them to reach you as far as your website or your email? What would be the best way if somebody wanted to come to Ocala and get ketamine infusion at your clinic, or maybe talk to you about trauma therapy?
So I'm going to post the website link in the chat box. I know some people had questions. I noticed some things coming up in the chat about cost and expense. And again, this isn't a promo for my clinic. I'm happy to have people come talk to me, chat with me online or whatever. We are the least expensive clinic in the Southeast. We've priced this very, very competitively. Our cost per infusion is $349, which is still a lot of money. I get that. It's not cheap, and it's usually not covered by insurance either. This isn't for garden variety depression. This is for people who've been treatment resistant. They've failed the usual talk therapy and medications. And if you're in that category and you want to give ketamine a try, you can certainly reach out to us and we can talk. But I agree, it is expensive, but we've made it as cheap as we possibly can. We're really, really, really price competitive. We're doing everything we can now to get insurance to help pay for portions of it, at least the office visit, and we do help you file to make that happen as well. Eventually, insurance companies are going to they're going to step up and do the responsible thing, but right now they're still, for the most part, refusing to pay for this, which is really a crime because it can be a very helpful medicine for folks.
All right, thank you. Hey, I want to do some shout outs for the folks that are joining us on the call. Amy Langer, it's so nice to see you on the call. Alicia, and we've got Ted Lyons and Shiloh and Jamie, I saw you on the call, and Heidi Cohen and Danielle and Christine. So glad you guys made it. Gary, and we have Jeff Kelly, my friend. Glad to see you. Bill W. And Jules, I know you're traveling. And gosh, it's great, Lilia. It's great. I'm glad you're with us, Kashi, Sandy, and Emilio. Hi there, and Bonnie Joe, and Raphael, and Steve, and Jessica. You guys, it's great to see you, Francesca. Nice to see you, Darlene, Raphael, and Terrell. Glad you're there, Christina, and Kiara, and Andrea, and Virginia. Hey, you know, it's Amy. I'm so glad that you guys are with us today. And Lisa, I didn't want to forget you. And of course, it's just great to be able to come together as a community and connect again. And what a treat it is today to have Dr. Eric with us, to be able to give us more understanding and help us on our, on our paths. We're growing. We're trying to understand how to heal. And, we turn to entheogens to give us some insights into that, that way of realizing our true self. And, for many of us, we found that ayahuasca is one of those tools or those catalysts for our spiritual growth. And, we're trying to, in our Sunday service, expand the unit a little bit. And there's so many things out there that we may not be aware of. And so ketamine is one of those that I know it's fascinating for many people. It's a great rescue therapy for some that are in real trouble. Ketamine, besides an infusion, can also be taken in an intramuscular shot, correct?
Yes, a little bit different experience that way, but that is one of the ways. Sublingual lozenges are also another method of delivery, though by themselves they tend not to be as effective as when they're used with IV infusions in between.
Right. But I know people that have had some pretty profound experiences with the IM injections. So, yes. Yeah, interesting.
That's the piece I didn't get into, but there's the treatment protocol for depression and anxiety and mood disorders, but there is also the use of ketamine to assist therapy. And so not even necessarily multiple infusions over time, but just using it during an acute therapy episode, particularly with intramuscular or sublingual. It can lower the defenses, open up the heart, and allow people to engage in therapy, talking about and working through some things that are otherwise far too threatening for them to work through. So that's a whole different angle, which I didn't get into, but an important thing, not only for ketamine, but for psychedelics. I mean, that's really what psychedelic assisted therapy and clinical trials, that's what they're doing. It's about opening up the heart, finding things to work on, and then working on it later through integration.
Yeah. And can you share with us just a little bit about, I know that the work that you're doing with your ketamine patients, that you're doing kind of similarly like what we're doing with a lot of prep and a lot of post integration work. Is that right? How often do you guys do your integration?
So we have integration. It's once a week. We do it on Sunday nights. That seemed to be when it worked out best. I probably would do it more often. Most people don't take me up on the offer. It is, I wish that they would. What I can say is that just about everyone who comes to me is already working with a therapist that they trust. They're already working with a psychiatrist as well. And so they come in and we try to create a really loving, warm experience in the clinic as well, so that the setting are closely attended to. But just to know that they are working with somebody is really important. It's pretty rare that someone comes to me without. I do have, actually this evening at 5 o'clock, I have a women's Zoom that I do that we mostly work on trauma, actually. We deal with some of the things that come up during the infusions themselves, but a lot of it is me doing the trauma work that I've been trained to do and helping people process and move past that. I'm a big believer in trauma therapy. I think it's really where the root of so many of our problems, at least in the mood disorder realm, lie, and within addictions as well.
You know, I'm going to put you on the spot here, but I have a feeling that we have maybe another topic for another Sunday sometime in the future where we could really drill down on the trauma therapy component of this. That would be, I think, really helpful for our membership, because trauma is a big deal.
Huge.
It's a big deal.
Absolutely.
Yeah. Yeah. Hey, it's been great. I just am so grateful for all the time and effort that you put into this. I know that you're a busy doctor, and that you really did. You just really impressed me. Your presentation, the slides, the knowledge, the information, the warmth in your heart, the kindness in your soul. It's just so appreciative. I'm so glad you're with us. And so thank you so much, and appreciate it. And I can't wait till you come to see us and visit us again soon at SoulQuest. And, you know, anytime you want to come visit us, you just, of course, you know that.